Welcome everyone to the next episode of Purposely. I am so excited to introduce you to Beck East today. Welcome, Beck.
Hi, and thanks for having me.
No problems. So Beck and I have known each other how long for? About a year, do you reckon?
It was October. I was started with Acorn, so just before that.
Yes, and it was really interesting when I first met you. I was watching this show on Netflix, and I can't even remember what it's called. I think it's actually called Nurse Practitioner or something, about a nurse practitioner, and I'd never ever heard of one. And then I learned that you were one, and I was like, "This is so random." I've never heard of this profession, and now I've seen it in this show, and now I've actually met a real life nurse practitioner. So for everyone watching, if you're at a barbecue or if you're allowed to do that, are you allowed to do that in regional Victoria?
Not at the moment, no, only with certain people.
Yeah, so if you were allowed to go to a barbie, imagine that. Like, God, that'd be so much fun. And you introduce yourself and you say, "Hi, my name's Beck." Well, how do you explain what you do?
Yeah, so it's something that I struggled with very early in my career because people weren't aware of it in the community, and I sit between almost like a registered nurse and then a doctor. And I mean, there's not many of us in Australia anyway, but basically I've become to say I'm a nurse practitioner. So instead of a general practitioner or a GP, I'm an NP. So, but I specialise in orthopaedics. So I specialise, in orthopaedics and bariatrics, a little bit of bariatrics as well. But yeah, that's essentially, I like my patients like to understand it's very much like a registrar position. If for those who have dealt with registrars within the medical profession in a public setting, that's what I do. So care from a patient from the moment that they're booked for or before surgery to all the way through their journey, including helping with the operations.
So for everyone out there, so you went to school for the same amount of time as like a GP went to school, and you had to, like, what's the difference? Can you prescribe medication and things like that?
Yeah, I can prescribe medications, order blood test pathology, x-rays, diagnostics. I have some Medicare rebates for those. I'm a little bit restricted in that way. We're hoping that actually the Australian College of Nurse Practitioners do some wonderful advocacy work in around having more access for nurse practitioners for those type of things, and it's under review at the moment. So only good things can come from that. But I did my undergraduate, so I was 3 years at uni doing my nursing. And then I decided to do my postgraduate in Periop. That very much became operating nursing for those of you who aren't unaware of medical and nursing terms. And then so that postgrad in basic Periop nursing actually then led me to decide that I was going to do a master's in Periop. And then I actually decided that while I was here and I was enjoying the nurse practice, I did some of the units for the nurse practitioner masters in my postgrad. And then I decided, I had one conversation with an anaesthetist, a colleague of mine, and he said, "Why don't you do your nurse practitioner?" I went, "You know what? I'm actually going to go and do it." So here I am. That was the double masters was over 3 years.
Wow. So yeah, you've pretty much been to school as long as a doctor needs to go to school. Like, it feels like it's one of those professions where you have to do so much study before you're allowed out into the world. So why do you think so many people have never heard of a nurse practitioner? And why is there so few of them in Australia? Like, is it more of an American thing, or?
It is very much it's very heavily flooded over in international, particularly UK and the US. There are a lot more nurse practitioners, and there's even a lot more levels of that type of thing over there. Nurse practitioners started here, I can't exactly remember the dates, and I probably really should, but it was a number of years ago. And it's really been slow uptake. I think there's two kind of pronged approach to that answer. One is that we're so heavily, we're lucky that we have relatively good medical support in Australia. So that role of the nurse practitioner never really filled gaps. I think now as we get older, our population, the needs, and also the specialisation in and around medicine has really helped, someone like myself fill that gap that wouldn't otherwise be filled. It would be purely run by the surgeon, and he would manage everything. And he would maybe have a nurse in the rooms. He or she would have a nurse in the rooms, but they would manage. Whereas I can provide that additional level of care that a registered nurse can't. And in fact, the guys get to operate, I get to manage everything else, and the cogs just work beautifully. So I think there's a two-pronged approach. What was your other question, Em? I've got
why I said, why is there so few of them, and why do people not know about this thing called a nurse practitioner? Because I don't think many people would have even heard. Maybe in the medical profession people have heard of it, but us lay people like me.
Well, I can tell you even some of the nurses out there don't really understand the role either. And that's purely because I think, we've probably done a lot more work now, advocacy work now as nurse practitioners, and as I said, the college has done wonderful. They've had done some marketing and have really escalated up to government level. But I think it's just around, as I said, that specialty. So if they might be in general practice, the nurse practitioner, but a lot of nurse practitioners are actually specialised, like myself. So they would only know about me unless they went to a clinic. It makes sense. Yeah,
it does. And so what's people's reaction though when you tell them I'm actually a nurse practitioner? I'm pretty much the same as a GP. And I know we've talked about this, but do some people go, even in the medical profession, do you think that some doctors, I'm not going to speak out against doctors, but they are sometimes a bit condescending? Shall we say?
Very early in my career, as I said, it was really there was this kind of bad juju in between nurse practitioners and general practitioners. But as I've grown in my role, they've learnt all about me and what I provide, and they understand that I'm not actually a threat. And in actual fact now, a lot of them will ring me and say, hey, I've got this fracture, or I've got this patient that I can't facilitate their care, things are not happening in the public system, I've got X, Y, and Z. What would a good X-ray be, or what would imaging? So it's been a process. I think we're not there yet, and I do believe that nurse practitioners in Australia are underutilised, and I think we could wholeheartedly absolutely fill a lot of our gaps, particularly because I know, being from regional Victoria, we struggle to get GPs, or they rotate through very quickly. I could have $1 for every patient that said to me, oh, I don't really have a regular doctor because I can't keep one down, they don't stay. That I really do believe that nurse practitioners can fill that gap. But I think I work collaboratively, and I've been very lucky that we've had teams that have collaborated with me. We're lucky in Bendigo here because there are actually quite a number of nurse practitioners, so the model was already well known. And the gentleman who actually employed me very early in my career, his wife was from America, so they knew the nurse practitioner model over there long before we've known it here. So yeah, it's been a rough road, I will be honest, and say there's been patients and medical practitioners, even nurses. There's some nurses who actually disregard me and my knowledge and not respect me. But patients, I would say 99%, all very happy to see me, very, very very, very engaged when I do work with them. And in fact, a lot of them don't want to bother the surgeon, but will be very happy to contact me and have a telehealth or a visit to ask questions, which that's what I'm here for. I love explaining things to them. So, yeah, it works well.
I'm sure it does. I think it's awesome. But your other role, so you've obviously got your own business as a nurse practitioner, and you're a specialist in the orthopaedics. That's the right word. Excuse me, I'm not a doctor or medical person. I get like tongue twisted. But you also play, and you also have another really important role, and that's kind of how we met, because we recruited you into the role as CEO for Acorn. So for all those people out there, what is Acorn? Because I had never heard of it before we were approached to recruit the CEO. But what you're doing is actually so important. And we all know that nurses in Australia and healthcare workers in general are quite often undervalued, mistreated, underpaid, overworked, shall we say. And so what is Acorn, and what is your role? What does the organisation do, and what do you do there?
So Acorn is the Australian College of Perioperative Nurses, and perioperative encompasses every patient's basically surgical journey. From, as I said, from nurses who work in the clinic to being booked and support surgeons and make them get ready for surgery, all the way through admission, hospital, intraoperatively, so actually operating theatres, and nurses that take care of them in there, so both circulating and instrument nurses as well as anaesthetic nurses, and then recovery nurses, and all the way to the patient is discharged. And then again, as I said, comes back to that, either visit in an outpatient's clinic or in private consulting rooms. So we encompass the whole surgical journey, and we represent perioperative nurses that encompass the patients and nurses in there. And what we do, well, our mission is to provide for patients, Australian patients, to receive safe and quality care no matter what in Australia. And we represent, from an advocacy point of view, we're really building that. We are a professional organisation, so we represent perioperative nurses. Wow, what a year this has been to represent nurses. Talk about jumping in, being thrown in the deep end. So we represent, provide education, provide events, and advocate for perioperative nurses in Australia. And we also have affiliate members, so international nurses as well. We do quite a lot of work over in Papua New Guinea and Pacific Islands as well.
And so to be a perioperative nurse is obviously like a form of a specialisation, and I imagine that these nurses are highly trained. And I think that one thing I've learned working in the health space in aged care and having a nurse work for me, and I didn't really understand this until I had a nurse working for me and we did a lot of work in aged care, but in the medical practice or in the field, the nurses are actually the ones who do most of the work. Would you agree with that? Like, people think that a nurse is just there to kind of assist the doctor, and you are not really that well trained, and that you don't really know anything. And what I learned is that the nurses are actually the one who do the lion's share of the work. They are highly skilled, highly trained individuals, and they're quite often underpaid compared to their counterparts that are doctors, and also not really respected. Would you agree with that?
Yeah, I think it's definitely, I would say, particularly in my role as CEO, I feel there is starting to be a shift, and whether that's because I am kind of really hoping that as a CEO that is what we do, that we do collaborate, and we work as a team, not only in theatres, but from a college perspective, I've got some fantastic colleagues now and contacts that from the Australian and New Zealand College of Anaesthetists and Royal College of Surgeons, which in the operating theatre, that's exactly who we work with. So we've been really lucky in the last 12 months. I feel it's shifting. And I also, I'm really lucky that I have a fantastic team. When I go in and assist the operating theatre, I have full respect. We work as a team and we really are always there for the patient. And I would say that is probably, our members would tell me maybe differently, but I would say that probably at least 80% of theatres in Australia would be like that. We are all there for the patient. There are, of course, cultural issues and historical issues. It was very much when I was doing my postgrad or even studying, I did some work in theatre, and I still remember one of my mentors that was assigned to me, and she said, "Now, you as a scrub nurse was what we used to be called. As an instrument nurse, you need to anticipate what that surgeon says, and you give him the instrument that he wants. That's essentially what we do, is you just hand up instruments." Now, that's historically been a very much, a cliche around perioperative nurses. But I really wholeheartedly, there is such a greater depth to what we do. It's so much deeper. And I think, as I said, going back to the question, I think we are shifting things, and there is some cultural changes that need to occur. But I can, if our members our members were watching today, I can't tell you how collaboratively we are working with our other professional organisations and colleagues. And I'm hoping that then there will have a knock-on effect within each perioperative services unit across Australia.
And so with the work that you're doing in the advocacy space, and we've talked about this before, so I kind of know a little bit, but you're advocating to standardise or create standards for your industry. So what does that mean, and why is that important for perioperative services?
Acorn, one of Acorn's core business, which I didn't really go on before, but is to develop the Acorn standard. So it sets the bar of how we both articulate ourselves as a professional position, a registered nurse, and what we actually do and how we should uphold our professionalism. But it also then goes to the clinical standards, so how we wash our hands and what attire we need to be wearing to wash our, to scrub for a procedure, what instruments should be washed and how they should be washed. So unfortunately, our standards are not legalised. They're not necessarily, have to be upheld. But it is really, really important in a perioperative unit that we do have these standards. And I would say that they are adopted in most hospitals. And I can tell you, Em, that Acorn have actually been contacted by a number of legal firms in and around compliance to standards, to the Acorn standards. So, and in and around Acorn registered nurses' professional behaviour. So, although they're not legalised and they're not mandatory, they are still really being respected within the higher levels of government, legalisation, those type of things, professionalism, all those things. We are, though, actually running we've just started a huge project, one of the biggest projects that Acorn's ever seen, which is called the Roadmap to Recognition. And that is around the Acorn standards and actually escalating them to the importance that they should really, and to be really escalate the value of them, and to be able to prove the value of them, and again just raise the voice of not only Acorn and its professionalism and organisation, but the actual standards. And there's no negotiation we as perioperative nurses need to adhere to.
Oh my God, my dog is snoring so loudly.
That's so cute.
God, he's like fully snoring. Sounds very relaxing. So is this kind of like in aged care, because we've done a lot of recruitment in aged care, and there's always this big kind of discussion in the media about the lack of ratios, so nurse to patient ratios, and I've heard horror stories of 110 bed facilities having one RN for the whole facility, and they are literally on call 24 hours a day, and they have personal care attendants and other untrained people responsible for looking after some pretty high needs residents. We don't call them patients. And I think that what's happened with COVID has really highlighted the fact that the aged care industry in particular really needs to look at the way they regulate and have standards, because it seems like they're not really doing a great job. And I would hazard a guess that, like with the hotel quarantine situation, when you have untrained people doing jobs of high importance and high impact, you get bad outcomes.
Yeah, it is. Acorn do have, as part of our standards, we do have a standard around staffing and what the recommendations are for what a staff is in intra-op, so both scrub, scout, instrument, circulating nurse, anaesthetic nurse, and then we also have recovery. So and who at what level do you need a certain amount of staff? Is it 1-to-1? Is it 1-to-2? And it does that. Unfortunately, that's not part of the ANMF, which is Australian Nursing and Midwifery Federation, which is the union. But actually, boldly last year, the Acorn board had a strategic plan, and in that strategic plan, which is all my responsibility to help drive the board to do that, there is in there around the staffing standard and escalating that to ANMF and having that a part of the union, basically the fair work and the contracts that every perioperative nurse would be signing off on. So, it really is about that advocacy and about safe workplaces, and at the end of the day, safe patients, patient care, and quality care for them, for sure. Yeah.
And so I'm just amazed that these things aren't legislated, that it's not the law. Like, I mean, in childcare, for instance, and this is the analogy I always use, in childcare there is child to carer or educator ratios, and they are mandatory. And if you are caught breaching those, you lose your license to basically look after children. So we have these laws and these regulations and compliance standards for the childcare industry, yet the health industry doesn't seem to have to live up to the same standards. And there is a lot of discussion around the lack of regulation in the health and aged care sectors, and the fact that it has become a money-making, factory. It's a highly lucrative industry, and there's some really big players making a lot of money at the expense of our older generations that are, I don't think, being given the care that they deserve. With what's going on with COVID, do you think that any of this is going to change, or is it going to get worse?
I think from a generalised health perspective, I think things will change. I mean, it's been really positive to see that Alison McMillan, the chief nurse and midwifery officer, who was recently appointed, I actually got to meet with her in February and then have subsequently been working with her during COVID. Now, to have her on television and to be reporting these type of things, that's never really happened before. And in fact, she's actually got an aged care background. And she's very passionate about setting things straight. So I'm really hopeful. I'm really optimistic about what this means for nursing. And in fact, this year is, I don't know if you know, Em, but this year is actually the year of the midwife and nurse in Australia.
Oh,
yeah, organisation. Well, it's actually international. Sorry. So we should be celebrating nursing, and I think the community have got a far, because of all the media around COVID. Sadly, there was some bad media in and around the healthcare worker cases, and how whether PPE was appropriate and whether they were undertaking their own role. And I don't know. Well, no one will know what was going on really at that forefront, because we weren't the nurses that were doing it. But I genuinely do feel Greg Hunt, the health minister as well, he's very passionate about nursing, and they really are starting to use, the nursing is becoming, nursing is all becoming very much, health is very much the forefront of this year. But I really do think that it's enlightened them to show healthcare workers, nurses all around the world have really had to have, these guys have been the frontline workers. They've really shown their role. I'm not a big fan of the slogan heroes, because it's simply what we choose to do every day, and most of us like it. So it's that I think we've really shone this year, regardless of the horrible year it's been.
It has, really, hasn't it? It's been a bit of a shit show. So how do you think that that COVID is going to change the world as we know it, like being on the front line but working in the health space? Do you think that we were ever ready for a pandemic? Like, it's really, I mean, are you ever ready for a pandemic? But this is me just being a layperson who doesn't work in the health space, but it's like, aren't there like hundreds of thousands of epidemiologists and virologists and all these people who are like experts in this field, and you'd think that they'd have done modelling and like planning and kind of worked out the best way of dealing with this, because there is, an enormous kind of divide at the moment. You're either in the, yes, we support lockdown camp, lockdown's the way to go, or you are like, no, lockdowns don't work, and the actual the implications of lockdowns are far worse than the outcome. And like in Victoria at the moment, we're seeming to go down this path of eradication, even though Dan Andrews will not admit that. Essentially, we will not be let out of our houses until there's 14 days of no cases. So I don't know. I've just asked about 5 questions, but what are your thoughts on that?
Do I think we can be ready for this type of thing? Like, I certainly didn't anticipate that it would. I thought the first wave, I knew that we would essentially, I got a sense as a professional that we would get some type of thing. When it was starting to come in dribs and drabs, I thought this is really is quite serious. I don't think I anticipated the second wave. I don't think anyone did. And do I think that we were well prepared for it? I don't think anyone in Melbourne could have. I really do. Metro Melbourne was, I live in regional, and I didn't really feel like too much had changed. I'm actually quite comfortable to come to work and then go home to my farm and live on my farm for the weekends. But it really does. I don't think anyone could have anticipated it. And how do you prepare for it? I don't think you can either. And I don't think, and I agree with you. I think the implications post-COVID are phenomenal. I can only speak for kind of peri-op nurses and my world, but it's been very difficult, I think, for perioperative nurses because of the range of, and it's been hard for me as a CEO to advocate for us as well, because some have literally been business as usual, not changed much, kept going. There's been nurses who have been redeployed. There's been nurses who have been sent home and said, we don't have leave, go and have leave, we don't know when you're coming back. There's been also the extreme of other nurses who have literally had to be on the front line intubating and managing a COVID patient who needs surgery. So it's been really challenging, and I think from a professional organisation, it's just been really difficult to try and support everyone in all of those kind of situations. But I do think that the one good thing that I find is the camaraderie between medical and nursing staff, but also just nurses in general. They've really stuck together. There will be long-term ramifications, as I said, and mental health concerns, particularly, I suspect, in Metro Melbourne. But one thing that I do, and my standards manager, Kath Murphy, will very much be very happy if I say this, but she's an infection control guru. So she'll be all about, thank God, people actually really make sure that they wash their hands and their hygiene is far greater than what we ever had. And look what we've done with the flu. We've had no flu. So it'll be really interesting to see how our ongoing hygiene and infection prevention and control systems continue to go, which is really the baseline of everything that particularly perioperative nurses do, but all healthcare should have that basic knowledge. And that's what I kept telling our members is, guys, no matter what, the basics are there.
Exactly.
We have to wash our hands. We wear our masks every day. I mean, it's just unfortunate that I've got to wear it in theatre and then come home and wear it out of theatre. It's big, and I think, but I really do think there'll be some tough times afterwards. But I think there's some really positives that'll come out of it as well.
Absolutely. I think that this whole scenario has definitely brought things into perspective for so many people, and it's made you realise what's important and what's not important. I know it's really done that for me. I'm not going to lie, being in Metro Melbourne sucks, and I feel like we're not only pariahs, but we're just now being punished, and like it's just really hard to swallow when other states have probably similar numbers to us now, but we're still in pretty much full lockdown. Like, we really haven't got anything back. We can't have anyone over. We can only meet people at the park, and like just the amount of businesses that are closed. Like, I just think that it just feels like it's never going to end, and that there's no end in sight, which is really tough from a mentally. And I just feel bad for all those business owners out there who are just in limbo. I was speaking to someone today, Shelley, who works for me, and she's got a friend who owns a gym, and they haven't been open since March, and they're just, like many businesses, in so much debt from a rent perspective. And it's like, how can you, doesn't matter how much money the government give you to pay your JobKeeper, which is not a real wage, let's be honest, for most people. Like, how are people going to pay the rent? Like, I'm paying about 45 grand a year in rent for an office that nobody comes to, and I'm lucky enough to have a landlord that's given me some rent relief. But like, I'm driving around Melbourne, and the doors are shut. Like, so many takeaway shops and hospitality businesses are boarded up. They're gone. They're finished. And it's like, they're talking about, like, this is a massive transfer of wealth, and it's essentially just getting rid of the mum and dad's small business, which kind of happened during the 90s recession anyway. And whatever's left, like, is just going. So it's God, I've just got really depressing then, but
No. I think, well, look, I do. I mean, even here in Bendigo, it's been very, very much like that as well. You've either had that spare bit of pocket money in the back that can get you through, and then there's others that have really purely just been running on an oily rag beforehand. And I think it has taught us differently as well. I think there's been, the word for this year is pivot, isn't it?
And that word. Pivot or unprecedented pivot, they're the two.
Unprecedented and pivot. So I think been some that have embraced it, and then some that have gone, you know what, this is all very too hard. And I really genuinely worry, like you, I worry about the future of Australia, full stop, and what this means from an economy perspective. Because, it's going to be a very interesting journey.
It is, and I just wonder where all this money comes from. It's just like, oh, here's billions and billions and billions of dollars. Like, let's just print all this money. Like, I just find it bizarre. I mean, I'm not an economist.
No.
I don't understand how this shit works, but I just don't understand how miraculously the government just has, like, we're already in debt. Like, who's going to pay for this? Like, our kids and their kids and their kids are going to be paying for this for decades, next 100 years probably.
That's right. It will impact us. It will impact us. Probably, actually, you're right, not us, maybe our kids, for sure.
Our kids, yeah.
Our kids. But I think, it will impact, and it can't just come from anywhere. And I think people who think that that's the case, it's actually really interesting, because I was talking to a patient the other day, and they are desperate for staff. They are desperate for staff in their 4 businesses.
Wow.
And they want people to work for them, because the people are getting JobKeeper or the support from the government. They can't pay them as much as that, or it's casual, or what have you. There's been a couple of patients of mine that have said the same, like, we can't get anyone.
I have heard that. I've heard whispers of that, which is concerning, isn't it? Because we're creating a welfare mentality. I mean, I'm working in the HR space. We see it from an employee entitlement perspective, like people who are being stood down and then they get asked to come back to work and they're like, no, I just want to stay at home and get JobKeeper. It's like, no, that's not what it is about. But are we creating a whole generation of entitlement and people wanting to get sit-down money? It's going to end soon, though, guys. Like, if you're sitting back and enjoying it, March next year, it's going to end. And the whole way that they doubled the New Start allowance, or the dole, that's what we used to call it in my day. You're a dole bludger. You're not allowed to say that anymore. That's not politically correct.
I wasn't allowed anything, because, as a farming, we had too many assets, so I wasn't allowed to get much while I was at uni.
So, but they just literally doubled that. The fortnightly payment was doubled. So, I have heard that is going to stop. I don't know when, but I did hear them talking about it on the radio. So that's going to impact a lot of people who are at the lower socioeconomic scale. And I think that what I'm noticing is that COVID is now a virus that is really impacting on 3 groups: aged care and aged care workers, healthcare workers, but also disadvantaged people who live in lower socioeconomic areas, who have kind of unskilled jobs, that work in factories, meat works, supermarkets, the people who are on the front line, and people who can't work from home. They're the people who are contracting it. And so it's now become and the way I see it, like, almost if you get COVID now, it's like you're a bad person. Like, it's like almost like it's illegal to be sick, and you then have to stay in your home. And if you're like, I don't know, I find it really disturbing that's kind of, that's where we're going with it. It's like kind of this, it's like having AIDS if you've got COVID. Like, that's my thinking.
Well, I think that was a result, and that really shows when, unfortunately, early in the second wave, there was those people that, and we weren't disclosed as to who they were and what kind of workers they were, but they weren't staying. They were still going to work because they were petrified of actually having that sick leave. So that's the report. But I don't think the media helped any of that at all. But as I said, we won't really know unless we were really there. But perioperative nurses, they know how to do PPE. They've always done it. It's part of our role. In fact, a lot of our nurses around Australia were the ones providing the education around how to don and take it off and how to wear an N95 mask. And they were really leaders in around that, because we have to wash our hands far greater than what any other layperson and nurse does.
Absolutely, yeah.
I think we were leaders in that, particularly in that perspective. But it's really interesting, because I thought I would have actually for sure got it. I don't know why, but I really, because I've got patient contact every day, I just thought there would be at some point in time where I would have to ring my husband and say,
I've got it.
Contract traced to me, to the clinic, or I'm actually starting to feel sick. But gratefully, I didn't, and I hope I don't.
Yes, yeah. But I know one person who got it, and they got it very early on, because they went to a bar, and the guy who owned it had just got back from Aspen skiing, and he came home a day early so he didn't have to do that 14-day quarantine thing, which, crazy. He went to work, gave it to his 2 bartenders, and then they had this is in March, they had a St. Patrick's Day event. Yeah. He literally went to the bar for 15 minutes, had a soda water, and contracted COVID, and then gave it to his wife. Didn't give it to his son, because his son didn't get it. No, I don't think kids are high risk of getting it. But, and he said that, and that was at the point where they were only testing you if you'd been in contact with someone or you'd just gotten back from overseas. So he rang up and said, I think I've got COVID, like I've got all the symptoms. And they're like, sorry, we don't have enough tests, so you don't meet the criteria. And then a few days later, he got called from the contact tracing saying, hey, were you at this place? Are you sick? And he was like, yep. And then he got tested. That's the only person. That is literally the only person I know that has had it. Which you just think that, I don't know, you know someone who got it. But, he just said it was like a flu. He had a temperature, and the worst thing was like a lingering cough that kind of just lingered. But, he's completely fine. His wife's fine. But, it's kind of like, I don't know, it's like part of me is like, maybe I just want to get it over and done with. They used to have chicken pox parties.
Yeah, absolutely.
Are we going to get to that point? Just, have COVID parties. But anyway, I shouldn't joke about it, but I think I'd rather get actual COVID than have the vaccine, to be honest, if they're going to push it through. In that amount of time. I don't know. What are your thoughts about that, about a vaccine that's ready in a year when normally it takes 7 or 8 years?
Yeah, look, I honestly, I'm not really all over it. And that's purely because I've been worried about elective surgery ramping up and getting our patients through who need it. But look, I think most important thing is it's evidence-based and it's really well researched, and it's not rushed. Because I think, I can understand the rushing, and it goes for anything in healthcare. Normally, if it's, I was always taught very, very well early on in my career, prior proper planning prevents piss poor performance, really. And,
I love it.
And if my colleague is watching this, she'll laugh and say, well, I've at least taught her something.
Yes.
But, it's got to be really well researched and really well evidence based, and it's got to be safe. So it'll be interesting. As I said, I really am not quite all over it, but it'll be interesting.
It will. Interesting times ahead. Well, thank you so much for sharing your story. You're an awesome millennial who's kicking goals. And the only nurse practitioner I've ever met in my life. It's pretty cool. So if you're interested in learning more about Acorn or about Beck, we'll put some links in the episode below when we publish. But thank you so much for talking to us. It was a very interesting conversation, and good luck out there on the front line. At least you're in regional Victoria and you can do some stuff. But I'll see you on the other side one day when we're
when I'm allowed to come down and you're allowed to come up. Absolutely. Stay safe. Thanks so much for your support, not only today but ongoing. And it's been great to chat.
Awesome. Thank you so much. And